Today, we're diving into a really high-stakes medical battle. We're talking about a relentless infection deep inside the brain. This is a fight where the standard weapons sometimes just fail, and that's when a surprising, everyday element becomes this incredible, unconventional hero. Every medical treatment kind of has a roadmap, right? A flowchart to guide doctors. But what happens when that path just leads to a dead end? When the patient isn't getting any better? Well, our story kicks off right there, in that critical moment where doctors are desperately looking for another way forward. So, first things first, let's meet the enemy. And believe me, this is a formidable one. It sets up camp in literally the most critical territory imaginable, the human brain. What we're talking about is an intracranial abscess, or an ICA. Now think of it like this. It's a walled-off pocket of infection. It's almost like a fortress built by these invading microbes. And inside that fortress, bacteria or fungi are just multiplying, creating this incredibly dangerous pressure and inflammation in the brain tissue all around it. So how does this fortress even get built in the first place? Well, the infection can kind of creep in from a nearby battleground, say a sinus infection or even a bad dental problem. Or it can travel through the bloodstream from somewhere else in the body entirely. Sometimes it sneaks in through a breach in the skull from an injury or a surgery. And what's really frustrating is that in some cases, doctors never even find the origin point. Now, you're probably thinking this has to be incredibly rare. And you're right, it is. The incidence in the United States is only about 0.4 to 0.9 cases per 100,000 people. But for those few individuals who get it, the stakes could not be higher. This is an absolute life-threatening emergency. Okay, so when you're faced with such a dangerous invader, doctors have a very clear two-pronged attack strategy. This is their standard battle plan. So on one hand, you've got surgery. A neurosurgeon will literally go in, often using imaging to bide a superfine needle and drain that fortress of pus. It is a direct physical assault. Then, on the other hand, you have a long and powerful course of antibiotics, which are designed to hunt down and kill any of the remaining microbial soldiers. And for a lot of patients, this 1-2 punch is incredibly effective. The infection gets cleared out, and they start to recover. But this is where our story takes a sharp turn. Because sometimes that fortress is just too strong. Let's dig into those really desperate situations. We're talking about the cases where the infection just digs in its heels, resists the attack, and threatens to overwhelm the patient completely. I mean, really think about it for a second. What do you do when surgery is just too risky because the abscess is sitting in a really critical part of the brain? Or what if there isn't just one fortress, but a whole bunch of them? Or what happens if the patient's own body is just too weak to keep up the fight? Over time, doctors have learned to spot the red flags, the predictors of a poor outcome. Things like having multiple abscesses, or one in a really deep or critical location. A weakened immune system is a big one. Or if a patient falls into a coma. When doctors see these signs, they know that standard battle plan, it might not be enough. And this is where our hero finally enters the story. And it's not some fancy new drug or a radical new surgery. It's something we all need to survive, but delivered in a completely new way. Pure oxygen, under pressure. This is hyperbaric oxygen therapy, or HBOT for short. A patient goes inside a special chamber, the pressure is increased, and they breathe 100% pure oxygen. What this does is it forces massive amounts of oxygen to dissolve directly into the blood and tissues, way beyond normal levels. And that unleashes some seriously powerful therapeutic effects. So how does this superoxygenation actually work? Well, it launches this amazing multi-pronged attack. First, it's a direct attack. It kills many of the bacteria outright because they're anaerobic, which means they just can't survive in high oxygen environments. Second, it reduces that dangerous brain swelling. Third, it basically supercharges the patient's own immune system, making their white blood cells way more effective killers. And finally, and this is so cool, it actually helps the antibiotics get through the brain's natural defenses to better reach the infection. It's an all-out assault. And listen, this isn't just theory. The evidence is coming straight from the front lines, from real cases where patients were pretty much out of options. Just take a look at the case of a 16-year-old boy. Doctors threw everything they had at him. I'm talking 4 separate surgeries, multiple rounds of the best, most targeted antibiotics available. And yet,
the infection in his brain was still growing. I mean, can you imagine how terrifying that situation is?
That's when they decided to try hyperbaric oxygen. And after 37 treatments, he didn't just get a little better. He made a full and complete recovery. That is just a staggering turnaround from what looked like a completely hopeless case. And this isn't some one-off miracle either. In a larger series that looked at 25 patients with these life-threatening brain abscesses, adding HBOT to their treatment led to a 73% rate of complete recovery. For such a tough condition, that number is truly remarkable. And the evidence is really consistent across different types of cases. You see it in that study of 25 patients with severe abscesses, in another with 7 patients whose infections resisted everything else, and even in the case of an 8-month-old infant. The story is the same. Adding HBOT helped turn the tide. So, let's circle all the way back to our flowchart from the beginning. Now we can see exactly where this unconventional weapon fits in. When a doctor sees those predictors of a poor outcome, the multiple abscesses, no improvement, the protocol doesn't say, give up. It says HBOT should be strongly considered. It's the official next step when the battle gets really, really tough. Now, it's really important to get this straight. Hyperbaric oxygen therapy isn't meant to replace surgery and antibiotics. It's what's called an adjunctive therapy, a powerful ally that you call in for the toughest fights to support the main treatments and give patients another real shot at victory. Which, leaves us with a really fascinating question for the future of medicine. As we learn more, could this therapy, the simple, fundamental act of breathing pure oxygen under pressure, become a much more common weapon against some of the most fortified and dangerous infections we face? All the evidence seems to suggest it's a possibility that's absolutely worth exploring.